Hello, everybody. My name is Julia Wolf, and today we're going to be discussing the effect of pyridoxamine treatment on arterial stiffness and cognitive function in old mice. When your arteries are young and healthy, they are like rubber tubes that can expand and constrict in order to accommodate increasing blood pressure. As we age, though, our large arteries, like the carotid arteries or the aorta, stiffen and become more like this rigid and inflexible metal pipe. When fluid moves through the stiff arteries, it hits the walls of the blood vessels with greater pressure, potentially damaging the vasculature. Stiffening occurs when the arterial walls come in contact with these sugars, and advanced glycation end products, or AGEs, are formed. This results in the collagen and the elastin in the extracellular matrix to become cross-linked, which leads to the arteries becoming stiff. Previous studies have shown that arterial stiffening leads to vascular dysfunction and ultimately cognitive impairment. Unlike large arteries, though, small arteries remain elastic as we age. For this project, a group of old C57 black mice was administered pyridoxamine-infused drinking water for 6 months, starting at the age of 18 months. Pyridoxamine is a form of vitamin B6, and it is known to inhibit the formation of AGEs in the sequence of events that leads to large artery stiffening. We compared old control mice that were 24 months old and young control mice who were 6 months old to the old pyridoxamine-treated animals. First, we collected pulse wave velocity data between the aortic arch and the abdominal aorta of our mice. The higher the value of pulse wave velocity, the more stiff the arteries are. Healthier arteries have a smaller pulse wave velocity. Pulse wave velocity was measured in the mice while they were under anesthesia using the Doppler method. In addition to measuring pulse wave velocity, we administered a nest-building cognitive test. We placed nestlets into the mice cages overnight and observed how well they built a nest by the morning. We used a 5-point nest rating scale. A score of 0 would be given to a mouse that basically did not even touch the nestlet, while a score of 5 means that the nest was perfectly structured in the corner of the cage with higher sides that make the nest into a bowl shape. A higher score is indicative of stronger cognitive ability. Passive stiffness was also evaluated ex vivo by exposing carotid and middle cerebral arteries to various static pressures and measuring their resistance to increasing pressure. We used a DMT pressure myograph for this portion of the procedure and assessed the artery's ability to resist the increasing pressure depending on how the lumen diameter changed, as you can see right here. Then we generated a stress versus strain curve that provided a beta stiffness parameter, which tells us how stiff a vessel is. We hypothesized that pyridoxamine-treated mice would have lower pulse wave velocity measurements and higher nest building scores than their control counterparts. We also expected them to have decreased beta stiffness parameters compared to the control old mice. The pulse wave velocity data supported our hypothesis in that the pyridoxamine-treated mice showed to have less stiff arteries and lower pulse wave velocity values. However, the cognitive test results did not support our prediction. It appears that the old pyridoxamine-treated mice had a higher average nest-building score, but there was no significance found between the two old groups. There was, however, significance found between both the old groups and the control young group, which is consistent with the idea that cognitive function worsens with age. For beta stiffness parameter, the large carotid arteries we tested displayed a trend for decreased stiffness with a p-value of 0.09, although no significance was found across groups. There also was no significance found for the small middle cerebral arteries we tested, but this is consistent with the idea that small arteries do not stiffen with age. What this data tells us is that pyridoxamine is a potential treatment for preventing the large artery stiffening and preserving vascular health to combat age-related health risks. Though cognitive impairment was not improved in pyridoxamine-treated mice, future research must be conducted to assess contributing factors to this data, including potential sex differences, environmental factors, and insufficient sample size. This research was funded in part by the National Institutes of Health and was conducted starting in the summer through the Oregon Undergraduate Researchers and SPUR program. Thank you to my mentors, Dr. Ashley Walker and Emily Reeve, and all of the members of the Aging and Vascular Physiology Lab for their help in this project. And thank you for listening to my poster presentation.